Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I'm really convinced that most clinicians are not familiar enough with iodine, its uses, why it's so powerful, and why it's useful in a practice. So I felt I would take the time to go over that and use this as a primer in the same. And the first thing I want to make you aware of, and this is the main thrust of this particular video, is that what does iodine do for us to begin with? And you'll recognize the importance. You'll realize how important it is to assay for it and to place it back. Cognitive function and neurodevelopment is and depends on iodine a lot for the development of the cognitive health and fetal and early on childhood stages. Adequate iodine will support the formation of myelin sheaths around the nerve fibers and indirectly support neurotransmitter synthesis by maintaining metabolic homeostasis. It also can prevent cognitive impairment, memory, and slower processing speeds are when the iodine's not enough. There are some studies that even mild deficiency in pregnant women can lower the IQ in that offspring by 8 to 10 points, independent of overt hypothyroidism. That's how important it is for pregnant women. Iodine has antimicrobial properties and plays a role in the immune function. It can neutralize free radicals. It reduces oxidative stress and inflammation as well. Our innate immunity, especially the neutrophils, well, iodine helps that. It concentrates in mucosal surfaces, salivary glands, respiratory tract. It's bactericidal, it's virucidal, it's fungicidal, and it is, of course, part of a lot of antiseptics. And iodine enhances that phagocytic activity of the immune cells. It's not studied as much, but it has been shown. Beyond its role in pregnancy and thyroid hormones, iodine supports reproductive tissues directly. Iodine also concentrates in breast tissue, where it may regulate cellular proliferation and apoptosis. Low iodine is associated with increased risk of fibrocystic breast disease and potentially breast cancer, although there may be some debate over that. Ovarian function is also affected because there's iodine receptors in ovarian tissue, suggesting a role in follicular development and hormone balance. And preliminary evidence links iodine's sufficiency to improve sperm motility and testicular function, possibly maybe the antioxidant effects. Iodine supports mitochondrial function, and we talk about how everything's mitochondrial disorders. It stabilizes the membrane potentials and reduces oxidative damage. It aids in the metabolism of environmental toxins, especially the halogens like fluorine or fluoride and bromide, which are so much around. By competitively binding to the receptors, iodine it reduces the accumulation of these other halogens. Iodine also contributes to the integrity of epithelial tissues. It promotes keratinocytes differentiation, collagen synthesis, and accelerates repair in the skin. It concentrates in exocrine glands, so it maintains their secretory function and protects against infection. Adequate iodine supports keratin production. So for your hair, it will help your hair strength and nail resistance also. And I believe wholeheartedly, there is emerging research that iodine has a significant anti-carcinogenic process. It's apoptosis induction. In vitro, iodine induces programmed cell death in cancer cells, especially prostate and breast, independent of the thyroid effects. It may reduce estrogen-driven cell proliferation in hormone-sensitive tissues. And you should note, regions of the world with higher iodine intake, like Japan, have lower rates of certain cancers, like, of course, breast and prostate. There may be other diet co-founders, but there's an influence even in cardiovascular system. Beyond the thyroid-mediated cholesterol regulation, iodine may reduce lipid peroxidation and protecting the vascular endothelial lining. Adequate iodine prevents goiter-related compression of neck vessels, and it does support vasodilation indirectly via metabolic stability. And one other, that's the gastrointestinal function it has too. Iodine concentrates in the gastric mucosa where it protects against pathogen. So mucosal integrity, it's supported by iodine and helps that gut barrier. I hope you can review this and understand the great importance of making sure that your patients are replete with iodine after you do iodine testing. Thank you so much for watching.